If possible, remove the patient's footwear and legwear to provide easy access to the distal pulses. In the affected limb, after determining and documenting the presence or absence of a distal pulse, proceed with the application of the Sager splint. Position the Sager S304 between the patient's legs, resting the ischial perineal cushion, the saddle, against the ischial tuberosity, with the shortest end of the articulating base towards the ground. In the case of a unilateral fracture, the splint should be placed in the perineum on the side of injury. In bilateral fractures, excluding pelvic trauma, the side with the greatest degree of injury should be the side of placement. Apply the thigh strap around the upper thigh of the fractured limb. Push the ischial perineal cushion gently down, while at the same time pulling the thigh strap laterally under the patient's thigh. This will seat the lower end of the cushion comfortably against the ischial tuberosity. Tighten the thigh strap snugly. Lift the spring clip to extend the inner shaft on the S304 until the crossbar rests adjacent to the patient's heels. Note the absence or presence of distal pulses. Check for sensation. Position the ankle harness beneath the heels and just above the ankle. Fold down the number of comfort cushions needed to engage the ankle above the medial and lateral malleoli. Using the attached hook and loop straps, wrap the ankle harness around the ankle to secure snugly. Pull the control tabs to engage the ankle harness tightly against the crossbar. Apply quantifiable dynamic traction. Grasp the padded shaft of the S304 with one hand and the traction handle with the other. Gently extend the inner shaft until the desired amount of traction is recorded on the traction scale. It is suggested to use 10% of the patient's body weight per fractured femur, up to 7 kilograms or 15 pounds for each leg. If bilateral fractures are present, the maximum amount should be 14 kilograms or 30 pounds. At the hollow of the knees, gently slide the large elastic leg cravat through and upwards to the thigh. Leave it laying flat. Again, gently slide the smallest elastic cravat under the hollow of the knee and seesaw it downward to the calves. Lay it flat. Finally, take the remaining cravat and insert it under the hollow of the knee. Lay it flat. As with any device that uses hook and loop fasteners, the cravats may engage on carpet unless care is taken during application. When you insert the cravats under the knee, the hook half of the Velcro fastener faces up on the end of the cravat being inserted. The loop half of the Velcro fastener, therefore, will trail and face down and will not stick to the carpet. Adjust the thigh strap at the upper thigh, making sure it is snug and secure. Make sure it does not impair circulation. Firmly secure the elastic leg cravats. Apply the pedal pinion or figure-8 strap around the feet to prevent rotation. Note the absence or presence of distal pulses. Check for sensation. Record the amount of traction applied and the presence of pulses. The patient is now ready for transport. The S304 Sager Form 3 bilateral should be applied to all patients with suspected or confirmed fractured femurs. It can be applied to children and adults in the case of unilateral or bilateral fractures. The Sager S304 can be quickly and easily applied by one attendant. The S304 Sager Form 3 bilateral, recognized the world over for its advanced treatment of femoral fractures in the field.